Hey there. It was just a little more than a year ago, in May 2025, the last time I checked in with my colleague, Julie Rovner. She's the chief Washington correspondent for our pals at KFF Health News. And in what I would call a normal world, like a little more than a year, would be really, really soon to talk with her again on this show. Because when I started making an arm and a leg, I didn't expect that trying to keep up with the news was going to be anything I would really have to think about too much. Like, I was setting out to understand and explain a multi-trillion-dollar chunk of the economy that isn't the tech industry. So I was like, how fast could it possibly move? And Julie Rovner's thing is fast-moving news. On her weekly podcast, What the Health, she leads a roundtable of health policy experts and journalists and pours over a steady stream of headlines. Like, whatever happens, big or small, Julie is tracking it. And then came 2025, and suddenly there's this avalanche of news, and it's big. Like, the Trump administration was making these sweeping changes, cuts to federal health programs. It was a ton of change. And I wanted to talk to Julie to try and wrap my head around it. And she told me even she was struggling to keep up. Here's what she said then.
I'm trying to keep a running list of what's been cut and what's been restored. And it's virtually impossible because there's 20 things every day.
Yeah, and a lot's happened since then. Like, Congress has added work requirements to Medicaid. It allowed federal subsidies for Obamacare to expire for millions of people. And those are like the biggest picture items. The rest of it feels like a blur. Like, pop quiz, do we have a permanent FDA commissioner, CDC director, Surgeon General? I looked it up. As of July 21st, the answer is no in all three cases. It's an avalanche. So I wanted to talk to Julie again to get a glimpse of that avalanche from like further up the mountain, so to speak. Julie, thank you so much for coming back.
Always a pleasure, Dan.
We'll see how much of a pleasure it is to talk about the American healthcare system. Let's give it a shot. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter. I like a challenge. So the job we've chosen here is to take one of the most enraging, terrifying, depressing parts of American life and bring you something entertaining, empowering, and useful. This time, with help from Julie Rovner. Here we go. Julie, last time we talked, you were astonished and worried about the pace of change and like destruction, given all the cuts at the Department of Health and Human Services. And here's what you said then.
How I've been thinking about this is that our healthcare system is a giant Jenga tower, and it's a little wobbly. And what holds it up is everything that happens from the Department of Health and Human Services. And they're yanking out sticks from this Jenga tower as fast as they possibly can. And when the whole thing comes down, it's going to be very not pretty.
So you said that a year and change ago. And just like the news I'm seeing this week, we're taping more than a week before we're going to publish this, but there's been a huge public health story in the news. You know, this outbreak of a foodborne parasite called cyclospora that causes explosive diarrhea.
A warning to more sensitive viewers, this next story is kind of gross.
If you are about to tuck into a bowl of raspberries or a big plate of salad, we're very sorry because we may be about to put you off your food.
If you're somebody that's into going to salad bars on a weekly basis, just give that a rest for a week or two.
Yeah, again, we're taping this in mid-July, so maybe all this gets cleared up by the time we publish. But right now, like, I'm personally having early COVID flashbacks trying to figure out what fruits and vegetables are safe to eat and how long I have to cook them. And, you know, sure enough, folks are pointing out that among last year's many cuts at HHS was federal tracking of a half dozen foodborne pathogens, including this one, cyclospora. So, I mean, it all feels a little on the nose. Julie, how are you seeing all this play out?
Yeah, it does feel very on the nose, if you will, because we're like a month into this outbreak and it's a very big outbreak, but we still don't know what's causing it. So now we're having, you know, I saw this morning a recommendation from a doctor said, just don't eat any fresh fruits and vegetables for the next week or so, because this is unfortunately a parasite that you can't necessarily get rid of by washing, which is not to say don't wash your fruits and vegetables. Do wash your fruits and vegetables, but that's not enough in this case.
Yeah.
But yeah, in a normal world, we would know by now what it was. And nobody knows what's safe to eat. And that's what happens when you pull those pieces out of the Jenga tower.
Yeah. And again, like a week from now when we publish this, who knows what we'll know, who knows what we'll be eating. But it seems symbolic.
Yeah, I think one of the things that's going on, last year when we had sort of Doge cutting and, there were headlines everywhere and these many people were being laid off and these many people were taking early buyouts. And, there was all of this sort of coverage, if you will, of all of these cuts. Things are still not happening and things are still getting cut and it's much quieter. Money that officials promised would get distributed as Congress ordered is not getting distributed as Congress ordered. So, there are people who are waiting for grants that have not come. Things are still getting cut. Political appointees are still making decisions that in the past were always made by career professionals, scientists, doctors, people with long experience. As we know, we've seen large cuts at a lot of these agencies. So there's a lot of expertise that's walked out the door. So even if there are people still there, they don't necessarily know as much as they used to. Things are sort of going on at that lower level that are not making headlines, but that are still, for the people who were involved in them, or at least what they tell me, are not great.
Yeah. And what are you seeing play out that as a result of the cuts that we've seen so far? Like, what are you hearing about that? What do I not know that my neighbors might be experiencing, but I just don't happen to be hearing about?
What you don't know is how many people are not getting needed medical care because they can't afford it, whether because they lost their subsidies for the Affordable Care Act and they couldn't continue to afford their insurance, or in even more cases, their subsidies went down and they bought down into less generous policies. And now they have, 5-figure deductibles. And so they have insurance, but they still can't afford to get care. Or they may be legal immigrants who lost their eligibility for health insurance that they used to have. Or they may be part of a mixed status family that dropped insurance because they were afraid of getting targeted by immigration authorities, even though, some people in the family were perfectly eligible for these programs. And we have seen states that are starting to cut back on Medicaid in anticipation of some of these federal cuts that mostly take effect next January, but that are starting to take effect in states already.
Some individual caregivers in Colorado are about to see their Medicaid funding cut.
Tonight, the major question remains, what can North Carolina do to make up for that major funding shortfall?
One of the biggest issues we knew the Idaho legislature would debate this year. Now, Medicaid cuts are moving forward 2 weeks ago.
And we're seeing states that are cutting back on optional programs, which, members of Congress last year when they were debating this bill said, oh, we're not going to go after people, who are seniors or who have disabilities, except those are the programs that are optional. And when states have to roll back their Medicaid programs, that's what they roll back. And indeed, that's what's happening. And we're seeing, story after story. But again, these are happening a little more quietly, making fewer headlines. But for the people they're hurting, they are really hurting.
Wow. Yeah. I mean, a couple of stories that you're reminding me of, right, that new federal rules keep rolling out. And some of them include eligibility for Medicaid for like people giving care or what it means to be medically frail and not be able to work. Tightening those restrictions and saying, look, you're going to have to jump through a lot more hoops to prove that you can't work.
Yeah, almost all of these rules are being, those are not finalized yet, but almost all of these rules are also being challenged in court by states, by healthcare providers who obviously wouldn't get paid anymore for providing this care, and by patients. So we will see, how these ultimately play out. But this administration has been sort of cut first, answer questions later. That's been kind of the theme from the beginning, and that is still what's going on. One of the things we're going to talk about on our podcast this week are stories of family caregivers, people who are losing eligibility for their families to help take care of them. And Dr. Oz, who's the head of Medicare and Medicaid, has been talking about people who are, collecting money for, going to the grocery store or bringing in the newspaper.
It's something called personal care services. You've never heard of that. Personal care services, basically, you're paying your kids to carry the groceries upstairs, but you're not actually paying. The state's paying, and then the federal government's paying the state back.
That's not what these people are doing. These are people who are changing feeding tubes and, helping people who are not ambulatory in and out of bed and on and off the toilet. I mean, these are very, very difficult jobs that, yes, sometimes family members are paid to do, but if they make it impossible, a lot of these people don't know where they're going to get help. And in some cases, these patients are going to end up in institutions, and that's going to end up costing the federal government and taxpayers even more money in the long run.
And these cutoffs are happening now. Like folks are getting notices or being told, like, no, your check for taking care of mom isn't coming this week. You're not getting that.
That's exactly what's going on. In my home state of Maryland, they are cutting off this program. I can't remember the exact date. There may be another month or so, but it's, they are getting notices that these programs are ending. And I think Maryland is one of a half a dozen states that's doing that.
Wow. Yeah. And this reminds me of something you said on your podcast recently. Like you're saying, these are huge stories. They're not getting a lot of attention. And I remember you said, what was shocking last year is this year's status quo, like at least in terms of media attention. But, you're still tracking all of it. And all of this is kind of reminding me of something you said when you and me talked the first time last year. So, like, our Zoom meeting started, we started rolling tape. I said, how are you? And here's what you said.
I have a shirt that says up and not crying. I also have a shirt that says, this is not normal.
And I wanted to ask you, like, how are you doing now? Are those shirts still in your wardrobe?
They are. And I have another one that says, this is my living in unprecedented times shirt. And I kind of rotate them.
And how? Because many of us have the option, I always figured I did, of like, yeah, I'm gonna titrate my exposure to news. I'm gonna calibrate, like, this is how much is good for me, is healthy for me to have right now. And, some people turn it off altogether. And you do not have that option unless you choose to do something entirely different. But, like, I want to ask you personally, like, what does that like for you?
It's exhausting. I mean, I worry. I worry about people who need health care and aren't getting it. I worry about students who are trying to decide whether they can actually pursue their dreams of becoming a healthcare practitioner or a scientific researcher, who are seeing sort of their pipelines cut off. That's a big concern for me right now. I see things like Ben Sasse, the former senator who was very near death from pancreatic cancer, suddenly being able to take a new drug. And he said that, his cancer is 99% gone. I mean, you see these medical breakthroughs that, frankly, government-sponsored research has helped bring to us. And I worry about whether they're going to be there for the next generation. I mean, that's something that's really sort of jumping out at me. It's like, look at all the things that we can do. Do you know why we've been able to do this? We've had this bipartisan agreement that investing in science and medicine is a good thing. That's separate and apart from the fact that our healthcare system is messed up and costs too much, which I know is what you concentrate on. Thank you very much. But, both of them are in trouble right now. And as I say, it's not so much, last year it was all the headlines. Now it's just sort of, as I said, it's kind of become the status quo, that things are crumbling. And that worries me even more than when it was all over the headlines.
Coming up, I get Julie's take on what's happening to the Affordable Care Act and what she thinks is going to happen in 2028 and beyond. That's next. This episode of An Arm and a Leg is produced in partnership with KFF Health News. That's a nonprofit newsroom covering health issues in America. The folks at KFF Health News are amazing journalists like, today's guest, Julie Rovner. Their work wins all kinds of awards every year, and we are honored to work with them. So, Julie, since the last time we talked, as you noted, some Obamacare subsidies ended, premiums went through the roof, millions of people have dropped their insurance, and lots of people have signed up for cheaper plans that covered less. And now, the Trump administration has been rewriting the rules for next year to encourage more people to sign up for plans that would cover a lot less, like including plans that require you to spend $30,000 or more to cover your family before insurance kicks in at all. And, like the two pillars of the Affordable Care Act were like, let's use subsidies to make non-crummy private insurance affordable for most people, and let's expand Medicaid. So Republicans kept saying they just wanted to repeal the ACA, but they never did. And now I'm wondering, like, are we seeing something that's like effectively kind of a slow motion repeal of the ACA by other means?
Oh, absolutely. No question about it. Most of the Affordable Care Act has been dismantled over, several people have written this story. It's like, Republicans failed on their repeal and replace when they called it repeal. But basically, over the last 10 years, look at all the things we've taken away. All of the taxes that supported the financing of this have gone away. So the supporting taxes, which were on mostly individual, they were on health insurers and drug companies and large businesses. Most of those have gone away. Thank you, lobbyists, who came and said, we don't want to pay these taxes. So basically, the money's just coming out of the Treasury now. One of the things that the Republican budget bill did last year was it didn't roll back the explicit expansion of Medicaid, but now we're going to have these work requirements for that, which what we know from other states that have done work requirements end up, yes, taking off people who simply refuse to work, but also because of the bureaucracy involved, end up cutting off people who are working and who are eligible and who do need the health insurance coverage. We have seen this, most of the people who end up getting kicked off the program get kicked off for what are called administrative reasons, which means they just could not navigate all of the required paperwork and bureaucracy. So, we really are seeing a slow motion repeal of the Affordable Care Act.
And so what might happen? You've been looking at this for 40 years, and I am old enough to remember as a young person noticing that, like, when Bill Clinton ran for president in the early 1990s, a big piece of the pitch was like, healthcare costs too much. Not enough people have insurance. We got to do something about it. And, they weren't able to pass a law. But where might things go?
Let me tell you one of the things that kind of freaks me out. And you go back to sort of the Affordable Care Act. I covered the Clinton health plan, and it died, as I like to describe, because, everybody, all of the special interests wanted to cut off just one finger of it. And in the end, the patient bled to death. That's sort of been my go-to metaphor for the Clinton health care plan. So what happened when they tried to put together the Obama health care plan is that, like rather than have all of the special interest outside of the tent, let's get all the special interest into the tent. And one of the ways they did that is said, look, if more people are insured, then you're going to get more of your bills paid. And particularly, the hospitals and the drug companies said, yeah, that sounds good. We would like people to be able to pay for the things that we provide. Well, so what are we doing now? We're taking this apart, and we're having people not be able to pay for things. And we're having states not be able to pay for things. States had used what was called creative financing for their portion of Medicaid, which, remember, is a shared expense between the federal government and the states. So now you've got hospitals freaking out. And you also, we're seeing hospitals close. It starts with rural hospitals. But, I like to say it's not just people without insurance who are going to be impacted by this. If health providers can no longer keep their doors open, then even if you have insurance, you may not have any place to go to get it. We're already seeing healthcare deserts in, less populated parts of the country. What is this going to do when you see fewer people with health insurance, fewer people with Medicaid, fewer people with the Affordable Care Act?
Wow. Of course.
Sorry, just a continuing ray of sunshine.
No, you're like, I'm asking you what might happen. You're like, well, here's the worst that might happen. But what might a path look like to changing course?
Well, I feel like, and when it comes to healthcare, the left is moving to the left and the right is moving to the right. We've always, in the 40 years I've been doing this, and even going back to things like Medicare in 1965, what has gotten things done is when the two sides come together and compromise. Those are the only big achievements in healthcare. With the possible exception of the Affordable Care Act, which Republicans say, oh, that wasn't, that passed only with Democratic votes, but it was a Republican idea. It was pulled from what Mitt Romney did in Massachusetts in 2006. So it was intended as a compromise, even if in the end the Republicans started moving right, I think, before the Democrats started moving left. But now you're seeing, most of the Democratic candidates, I'm looking in the midterms, are back to the mantra of Medicare for all. Joe Biden was one of the few candidates in 2020 who did not endorse Medicare for all. He wanted to just expand the Affordable Care Act. That's what was seen as a middle ground. Now nobody seems to want a middle ground. The right wants to just take everything apart and get government out of healthcare in general and let people, sort of give people a little bit of money and have them, have the free market take over. And the left wants Medicare for all, which is, the U.S. has tried to do what every other country has done and have universal coverage, and has so far not really succeeded at that. Although I will say at its peak, when the Affordable Care Act had the expanded subsidies, we were down to about an 8% uninsurance rate, which was the lowest since anybody had been keeping track. So it was getting closer. But now I see the parties moving apart. Will they move back together again at some point? I don't know. But for, I think, the immediate future, we're seeing them retreat to their corners. And in healthcare, that really, even though sometimes at the 30,000-foot level, they've been fighting about that, at the 5,000-foot level, they've been able to get together and do things. A good example is the No Surprises Act, the let's get rid of surprise bills. I'm not sure I even see them coming together on sort of the little stuff right now. Everybody is just very, very, very unhappy with everybody else.
Wow. All right. Okay. It's not the cheerfulest thing I ever heard.
You look like you're processing that.
I am. And of course, as you say, during this period when the greatest proportion of people had insurance, I'm still doing this show. I mean, people have insurance, but having insurance doesn't necessarily mean you have health care that you need and can afford.
Yes, everything. We will both be employed for as long as we want, talking about the foibles of the U.S. healthcare system.
I mean,
that prediction I'm very confident of.
And I'll definitely never run out of material. That's the crappy thing. But, as things accelerate, I wonder how that changes how you see your job description moving forward.
Well, one thing that I'm working towards myself is I am predicting that we are going to have another major political throwdown over healthcare in the coming years. Not necessarily next year, but probably, I think this will be a big focus of the 2028 presidential campaign. And in 2029, we're going to have a big debate. Are we going to solve anything? I have no idea. But in preparation for that debate, I feel like there's a whole generation that sort of didn't live through the Clinton health plan and that didn't even live through the fight over the Affordable Care Act. And that one of the things that I would like to do as sort of a public service is throw all of the options back on the table for people to see that, that if this was easy, we would have solved it a long time ago. So one of the things that we're doing as part of our podcast is a special project called How Would You Fix It? I am sort of calling every smart person I know from across the ideological spectrum and asking them, okay, how would you fix it? I'm nearing retirement myself. I feel like I have this obligation to kind of shepherd the people who want to learn through another round of this so that we can have an educated debate and decide what we as a society want to do about healthcare.
Wow. You think there will be a great big conversation. There will be a great big change.
I think there will be a great big conversation. I don't know that I think there will be great big change.
Okay.
I have covered enough of unsuccessful ones of these. I am not predicting its success. I'm simply predicting the fight. Fair.
But even so, having big public conversations seems better than not.
Yes, as a journalist, I would think so. As somebody who cares about the sorry state of our healthcare system, I think it's time. Frankly, one of the reasons I think this is about to happen is that when in the early 2000s, when we were sort of building up to the fight over the Affordable Care Act, you could sort of see it coming because everybody was unhappy and everybody wanted to sue for peace. That the hospitals were unhappy, the drug companies were unhappy, the doctors were unhappy, the employers were unhappy, the labor unions were unhappy. I feel like that is true again, and it's more true. And now even the haves, what we call them, the people who have insurance and don't want, are afraid of change, even the haves are unhappy. Everybody thinks they're paying too much, which is why I'm predicting we're going to have another big public debate about this in the next 4 or 5 years.
I think the prospect of having a big public debate about a big public problem also strikes me as like an optimistic stance for anyone who cares about, living in a democracy where people have a say in having a conversation.
Absolutely. It is. I'm sort of clinging to it as a hope.
Mm-hmm. I just really appreciate that. Julie Rovner, thank you so much for joining me. It's been such a pleasure. Till next time, I'll be listening to How Did You Fix It?
Thank you, Dan. And see, talking to you makes me feel better.
All right. That's what I'm going for. Let's stay in touch.
We will.
All right.
Great.
Take care.
Thanks, Dan.
Bye-bye. Okay, so I asked Julie Rovner how the avalanche of change has her thinking about her job description these days. And I want to share how I've been thinking about mine. You might have noticed over the last few months, we've taken a break from producing new episodes. And here's why. In April, there were some family health issues, like more than one of them, and they were kind of blossoming all at once. And as I turned my attention there, I realized I had some health issues of my own that needed attention. I started making this show 8 years ago, and I've been running it like on a shoestring ever since. And that's meant running myself a little ragged sometimes. Honestly, too often and for too long. So that's not good for my health. And it's not good for an arm and a leg, because a ragged version of me does not make the best version of this show. So I needed some time, like, to break some habits. Like I called it detox from workaholism. And I needed to attend to my own health. Earlier this year, I had scheduled a little surgery, and I put it off because I got sick from, you guessed it, running myself so ragged. And then, of course, I was still trying to run so hard, I couldn't imagine when I might reschedule it. So, honestly, it wasn't until I put myself on break for a minute that I even thought, like, oh, yeah, I could do that surgery now. So surgery happened in early June. I'm all healed up. And I've been working with a really excellent therapist. And I've been incredibly grateful to my colleagues for their patience and for keeping things running. And together, we're starting to put together some new ways of doing things. And it's going to be a work in progress because there's so many things we want to do. But I can't be a workaholic anymore. So for our next episode, we're going to bring back one more favorite from our archives, give ourselves like a running start. And then we have some incredible, important stories and projects we can't wait to get back to. So for now, thank you for sticking with us. It's a privilege to do this work, to make the show for you, to work with these incredible colleagues. So I'll catch you soon. Till then, let's all take care of ourselves. This episode of An Arm and a Leg was produced by Emily Pizzacreta with help from our summer intern, Lynn Barbera. Welcome, Lynn. And edited by Ellen Weiss. Adam Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Claire Davenport is our engagement producer. Amanda Boyd is our operations manager. Bea Bosco is our consulting director of operations. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. An Arm and a Leg is distributed by KUOW, Seattle's NPR news station. Thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. Finally, thank you to everybody who supports this show financially. You can join in anytime at armandalegshow.com/support.